Ma'am, please start. Thank you.
Good afternoon, distinguished guests and esteemed colleagues. On behalf of Palghar Academy of Pediatrics, IIP Raigad, Thane Academy of Pediatrics, and Maharashtra Adolescent Health Academy, I, Dr. Jayashree Deshpande, welcome you all. It's a pleasure to see many participants, and we deeply appreciate your presence. Please use chat box for your questions. As we celebrate Navratri, let us remember that true victory is not only the outside battles we fight, but it is conquering our inner battles also. Friends, fasting is not just a fasting or as a ritual, but it's a self discipline and also mindful eating. Also, Garba is a joy and community bonding. Let us celebrate this all. Over the next few hours, we will be able to hack our hormones. I have written specifically hormones from a distinguished pediatric psychiatrist from Pune. I am delighted and honored to introduce Dr. Bhushan Shukla sir. He is from Pune and he is working as Trimiti Clinic in Pune. He is doing no go tell workshops to prevent child abuse since last 25 years. With his extensive experience and in this field, he has been called upon as a consultant child mental health issues for 4 movies and 2 plays. We are certainly eager to watch them all. He is a co-author of the book Basics of Sex, Gender and Sexuality. Please join me in welcoming Dr. Bhushan Shukla sir. Sir, welcome.
Do you want me to start now? Oh,
Yes, sir.
okay.
Yes, sir.
Okay. Thank you. See, it is always a pleasure to speak with fellow doctors, particularly from Mumbai area,
Wonderful.
because you guys start on time, and as you can see that there is not much funfare about getting it started. So it is directly to business. So I'm happy to start sharing my screen. I realize that there is a YouTube live happening here. So I definitely want to put it out here straight away that this presentation is actually meant for pediatricians. Okay. So if any member of general public is seeing this, my request to you is that, yes, you can see it for curiosity. But if you find a lot of boring technical stuff there, please remember that it is for pediatricians of this specific group, that this is something that was created. So here we go. This is my first slide. I hope you can see the slides all right. Can somebody please give me an audible feedback?
Yes, sir. Yes, sir.
Yes,
It is
sir.
visible.
It is visible.
And full screen also.
Coming to the new generation, we are going to talk about hacking up things, which essentially means doing simple things that give dramatically different outcome. That is all that we mean by hack. Stuff that is cheap, that is easy, inexpensive, easily accessible, and can change the outcome of certain process. That is typically called as a hack. So how are you going to look at these hormones when they play up in stress and manifest themselves as anxiety? That is what we are going to look at. Now, the first question we should ask is that why should we even bother? There are hajar things to do at this particular age. Why should we talk about managing anxiety and stress at this particular age? So the simple answer for that is in front of you on your screen. The percentage of adult mental health issues that start in adolescence itself is 50 to 60%. Over half of adult mental health problems have their onset earlier. I think if that number is scary enough for you, then by now you must be already convinced that we definitely need to look at adolescent and take care of that. So, just a second, let me just move this around a little bit. Let's quickly look at the hormonal landscape of adolescence so that we will know what is different and what we need to do there. First thing is that the sensitivity of HPA axis is heightened in adolescence because this is a phase of very rapid growth, particularly psychosexual and physical growth. So we will come to the details a bit later. Second is that this particular phase of developing brain is vulnerable to stress. There are two big phases. First phase is first 1,000 days, which we talk about the golden period of early childhood. And the second period is adolescence, when vulnerability to stress is very high and you can have disproportionately negative impact of a stressful event. Then what we need to know is also that there is a quick destabilization. This vulnerability manifests as quick destabilization, which leads to mood and affective changes. Affect is nothing but a visible component of mood that you can identify in some person. So this quick destabilization is important for us because prefrontal lobe is not particularly well developed already at this stage. The development is happening. So the control of emotional brain is not yet fully established. So emotions run high and the control system isn't fully developed. So you see emotions quickly taking over and moving things towards action without much thinking. So this leads to unpredictable and volatile behavior. Another big challenge here, which is related to hormones, is addictions. Because all the addictions are closely related to neurochemical changes, and hormonal influence will decide direction of the addiction. That are you going to move towards just calming medications? Are you going to move towards screen addictions? Are you going to move towards pornography? What kind of addiction is going to happen with you can largely be decided by your hormones. Let's go again quickly look at the hormones of interest. I have just listed 4, but as you know, all the hormones are important, and I will not go into great details of that because we are going to focus on the second part, which is hacking. First is obviously cortisol. No discussion about mental health can continue or complete without mention of cortisol. This is a main hormone of stress response. The problem is that it has not the problem actually, the advantage is that it has a very effective negative feedback loop. Cortisol secretion can be reduced by various ways, and we are going to look at that in the hacks. It is not just a simple feedback loop that exists for most hormones, where as the level of the hormone increases in blood, there are clear receptors which will activate the negative feedback loop and the secretion will be decreased. Most hormones have this single feedback loop. For cortisol, even your thoughts or what you see or what actions you are doing, which is things even in your external environment, can act as starters of that negative feedback loop and can reduce the stress. This is quite unique only to cortisol. Second is testosterone. Interestingly enough, testosterone actually reduces stress responsiveness. This is quite a huge advantage of testosterone. Testosterone also directs you to sit at a specific place in the social hierarchy at home and in school as well. And many times aggressive responses are testosterone driven. In some children, this will also lead to worsening of their impulsive behavior. Third hormone of interest, depending on whether you want to follow the European or American convention, you will write that O or you will start the spelling with E. It essentially increases stress responsiveness. See, this is a very clear contrast between estradiol and its other hormones that come from it and testosterone. Testosterone reduces your stress responsiveness, whereas estradiol increases it. So girls are more vulnerable to various stresses. Social connection is typically a major trigger. which can cause a destabilization and start the cortisol cycle. Growth hormone is a new entrant to this group. Till recently, we believed that growth hormone does exactly what it says on the tin. It causes growth of muscle and bone. But we also know now that growth hormone plays a major role in modulation of anxiety. So you see very high anxiety states in children with growth hormone deficiencies. So this is important to know. There is a suspicion that growth hormone may also play a role in brain development and can develop selective memory storages, but the jury is out. We are not sure of that yet. This is just a diagram to let you know that except prefrontal cortex, which sits just behind your forehead, everything else is hidden deep inside, hardly ever visible. But they all have their own specific functions in anxiety as well as depression. For example, hippocampus modulates fear condition. Beta nucleus of stria terminalis decides uncertainty and anticipation. Striatum is important for motivating processing, and hypothalamus is important for stress regulation and stress triggers as well. Cognitive control via prefrontal cortex can actually have direct effect on amygdala and decide what kind of stress response and how long and how intensely it will continue. This is just a quick note to show you how it goes about. There is a mouse model which actually works on stress response. And what we know clearly is that during early adolescence, this PND number there is postnatal days. So 21 to 65 is the adolescence for that particular mouse, and 66 to 90 days are their adulthood. In this particular mouse, what is known is that if you increase the stress at that particular point, then neurogenesis reduces, neuroplasticity reduces. This is something that is really important because the more alternative pathways you have available, more easily you will be able to manage something, because you will be able to identify multiple ways of responding to that situation, and you will be able to choose one. If you do not have that much space, that much play in your brain, you will be restricted to only a few responses, so your learning will be hampered. So in behavior, it manifests as specific memory, inflexibility there, reduced learning and reduced recognition, and depressive behaviors, which are essentially helpless behaviors, or where the mouse gives up trying. You continue the same stress, and as a young adulthood, you see neuroplasticity going further down, making things a lot worse, ultimately resulting in depression or severe complications of anxiety. We are not much different, because what happens in adolescence is that the negative feedback mechanism that controls cortisol is less effective. It is not fully developed. So sustaining elevated stress hormone levels is very common. You and I, as adults, as mature adults, may feel that why is this child troubled for such a long time over such a small insult or such a small event? The answer actually lies in this particular mechanism, where cortisol takes very long time to settle down, so the arousal does not go away, so the emotional state persists. Second is that adolescents also show that their HPA axis activation is much more prolonged, with slower recovery and increased baseline. Now, these all things make it particularly vulnerable for women. These young women show this exaggerated response, so their baseline is high, so they get triggered very quickly. It stays for much longer time, and the recovery is very slow. So something that happened 3 days ago can also continue to bother them and can flare up very quickly. Now, this is what explains why the schools and families can become absolute difficult places for young girls. These hormonal features clearly heighten vulnerability to anxiety, depression, as well as behavior problems during adolescence. So just a quick recap, that in childhood, you have genetic vulnerability or vulnerability created by environment because of stressors. If they continue in adolescence, then you develop a pattern of stress response which makes you extremely vulnerable to all the negative events happening in your life. They also limit positive impact of positive things happening in your life. So adolescence typically becomes a make or break situation. Bad adolescence can essentially set you up on a lifetime of bad stress response, unfavorable stress response. That is why it is important to start working actually much earlier, but at least at adolescent level. So let's start looking at the hacks. Okay, the first hack is physical activity. Okay, physical exercise is one of the most effective ways to lower your cortisol. It also leads to increase in growth hormone, but this growth hormone is not immediately increased. You typically get a higher peak at night if you have worked out very well. Then it increases serotonin as well. So your mood regulation becomes much better. It reduces anxiety and agitation significantly. One hypothesis is that if you are already agitated, then the stress hormone, the cortisol mechanism is already at work. And the only way to reduce that, only way to burn off that is by physical exercise. If you do not burn off that additional cortisol circulating there, it is going to ultimately reach the emotional centers of your brain, Papez circuit, if you remember from your physiology days, and then it stimulates that, and then you get into that loop of anxiety. So exercise is one of the best things, even when you are agitated, when there is active disturbance happening. Going for a walk, doing some vigorous exercise for a short time can actually reduce the anxiety directly. Of course, exercise has a direct beneficial effect on sleep up to a point. If you are exercising excessively, your sleep also gets disturbed. We know that from studies in anorexia and bulimia. An important thing to remember for adults is dance is exercise. Dance, we are going to come back to art in the last slide again, but dance is actually the new antidepressant for mild depression. It is known, and there are more and more papers supporting this stuff now, that actually vigorous dance with a group or even alone has significant anxiety reducing and mood elevating properties. I would not prescribe dance as a prescription for a person who is depressed or an adolescent who's depressed. But if that option is available to them for physical activity and if they like it, then definitely it is very high on my list. But for this to be effective, this exercise has to be vigorous. That is why yoga by itself is not a complete solution, because most of the yoga focuses on flexibility and breathing. So it helps reduce anxiety, particularly the breathing exercises, and improves your body coordination and physical awareness as well. But genuine high intensity physical exercise is far more advantageous than yoga. Another thing is that a lot of young people are typically averse to yoga. They see it as activity of adults and old people. So there is no point in forcing it on them. But if somebody genuinely likes it, then yes, they are going to benefit from that. It should be for 45 to 60 minutes. This is very important. There are some studies which talk about actually incremental benefit right up to 120 minutes. Okay, but that is a very long time to spend exercising every day. A lot of people will not have that time. And here I have made a mistake. I have written there 5 to 6 times per week. That's a mistake. 3 to 4 times per week can definitely help. The effect increases if you are able to do it more frequently. Second hack, and this is an interesting one because all adolescents have this naturally, it is sleep. The better you sleep, the better you are. Because what sleep does is it actually stabilizes your HPA axis. So the stress response calms down. Your estrogen responses calm down. You get a lot of dreams, particularly in deep sleep as well. So your emotional regulation is happening with better sleep. And we all know that quality of sleep is directly related to memory. So particularly children who stay up very late and start sleeping less and less closer to exam are actually harming their brain and reducing their scoring potential by not sleeping adequately, by not using the memory mechanisms adequately. So it must be for at least 7 hours per day, with once a week sleep in, which is sleeping till late, till about 10 hours or even 11 hours. So weekly sleep-ins are absolutely fine. Colder temperatures usually help better sleep in adolescents and young adults as well. So if you are used to sleeping with your adolescents and they want to sleep in a different room, they want to leave the windows open, they want to keep the ceiling fan on a high speed, or if they want to keep the AC at a lower temperature, please let them do that. Even if they take a big blanket after lowering that AC temperature, they're still helping themselves sleep deeper. A lot of children, adolescents also tell us that warm bath helps a lot. So evening bath before your dinner is usually a good idea. Then hack three, which is about nutrition. Do I really need to tell a bunch of pediatricians about nutrition? Absolutely not. Because I know that every parent who comes to you, irrespective of the age of the child, they are absolutely focused and they will ask at least one question to you about what the child is eating, how to change that, and what is the best nutrition. So I will not get into details of that, but the quick things that connect nutrition with your mental health is avoiding. Okay, avoiding stimulants, particularly caffeines, sugars, and highly processed foods, will reduce anxiety to a great extent. This is something very important because more and more young people are getting hooked on to their black coffee. So we need to be careful there. A large proportion of those may be actually getting harmed because of that coffee. If a small proportion is reporting better focus and concentration on caffeine, there is a very high chance that they actually have ADHD. So it is better to get them checked. What boosts, what are the boosters that are generated by nutrition? And this is something that can be part of your advice. One is fiber. And it is very strange. How does fiber help? Fiber and complex carbs actually help you alter your gut flora to a more healthy level. So prebiotics, they work as prebiotics, and obviously there are probiotics where you get a combination. Only thing you have to make sure is that many of these bacteria and their spores taken via mouth get destroyed in stomach. You have to choose a specific formulations which will actually reach your intestine, and they have to be taken over a very long period because very few colonies will be developed with each dose, and it takes anywhere between 3 to 6 months of dietary change or regular probiotics for these colonies to actually get stabilized in your intestines. So probiotic route is a long loop, and it is important to remember that just one prescription, you're taking it for 8 or 10 days, does not help at all, irrespective of the numbers written on that capsule that it contains so many billion colonies and all of that. You still need to give a lot of that. Fourth hack, obviously, is psychological interventions. Stress management, learning stress management via very specific cognitive behavioral therapy techniques or mindfulness can be very useful. Mindfulness you can learn all by yourself, you can practice all by yourself. Occasional help from the supervisor or the teacher helps. CBT is obviously done with a good CBT therapist, or sometimes there are workbooks available as well. What helps a lot is interpersonal therapy, particularly for girls, because as we saw that estradiol makes them particularly vulnerable. Interpersonal relationships, group relationships, family relationships, and love interests are hugely important for them. They're important for boys as well, but girls seem to have a particularly high vulnerability when things go wrong here. So specific interpersonal therapy intervention really helps these adolescents to learn the appropriateness of relationships, how to modify those relationships, how to be assertive in the relationships, how to evaluate relationships, and how to protect oneself when things go wrong. Parent training also helps a lot, because right now we saw a lot of stuff about nutrition, about exercise, about mindfulness that can be helpful for the child. Helping parents do these things at home on a regular basis without sounding too preachy or too advisory really helps. So entire family chipping in and changing the lifestyle as entire family, not just restricted to one person, helps a lot. Parents also need to be trained about how to draw boundaries, how to help your child sleep better, and how to help them in their studies. So, child as well as the parent need to be educated about stress. What are the physical manifestations of stress? What are the psychological aspects of stress? And how is chronic stress working on that particular individual? See, this is very important. Unless this piece of education, this piece of advice is personalized, things are not going to change. So one person may have stress manifesting as their skin condition, other may have that as their digestive condition, the third one may have that as sleep disturbance, fourth one may have that just as anger related issue, or somebody may have that as heightened anxiety or even depressive symptoms. So generic vague advice does not help. Doing a proper stress assessment and advising them about how it manifests on their body and their mind actually helps a lot. And this is one last but extremely important piece about psychology. We hear counselors flourishing everywhere. Every lane has two counselors now. People do their weekend workshops and online trainings and put up counselor boards and start working. As pediatricians, you also may have been lured into weekend courses and online courses which teach you what is called as counseling. There is enough and more research to show that generic, non-specific counseling does not help. It is almost always, and I do not mind saying this on a public platform, that it is just nonsense. What really helps is a clear assessment, specific diagnosis, a clear treatment plan, and using specific psychotherapy that helps the child identify that stress, take ameliorating steps, and work on interpersonal relationship as well as on their self as well. Just generic counseling sessions where somebody just listens to that child for 45 minutes is not really a help. And something that is not really a help, but a person spends a lot of time doing that is potentially harmful as well, because important treatment time can get wasted. So unless specific psychotherapy is happening, generic counseling really has no role anywhere in mental health. If things cross that line, you move to pharmacology where help is needed with the help of medications. As pediatricians, I think there are certain things that you can prescribe safely, and it must be done as a first level of help before any referral can happen. Serotonin specific reuptake inhibitors are a safe and effective modality now. You can choose a drug of your choice, whatever you like. Though all of them are SSRIs, they do come with their own characteristics, and you will obviously be well versed with that. Only thing that you need to be careful is that the dose needs to be increased gradually. Adolescents need almost adult doses. So, for example, if you are prescribing escitalopram, in many kids, you will need to go right up to 20 milligrams gradually. It takes a longer time to show that action, and withdrawal symptoms are always a possibility. So when stopping it or changing one drug from another, you need to be careful. Another thing which I think needs to be used more frequently is propranolol and clonidine. When there are very high physical or very intense physical symptoms, then propranolol or clonidine is of huge help, particularly in short term in crisis situations. As pediatricians, you are quite confident of managing the heart and the blood vessels part of it, the blood pressure part of it. It doesn't scare you. So do use it. Typically, propranolol 5 milligrams TDS or even 10 milligram TDS for an adolescent works very well. Clonidine, people have used that right up to 200 micrograms per day divided in 2 doses or sometimes 3 doses. Again, withdrawal will have to be gradual and careful if you are giving it for more than 2 weeks. But these are medications which are used very rarely but have a clear help particularly in reducing acute and severe physical anxiety symptoms. When all else fails, all of this is done and it is not working, then it is time to refer to a psychiatrist. There are clear indications when you should be sending them to a psychiatrist. First is you have tried SSRI and it is ineffective. That is a clear indication that something more serious will need to be done, and here a specialist will be of good use to you. If you pick up suicidal thoughts, impulses, or plans in the adolescent, then it is definitely an urgent referral, because we know that in the age group of 15 to 29, suicide is now becoming a leading cause of death in India. I think at present it is at number 3, but it is climbing up very quickly. So this is something that no doctor wants to have on their hand. If Unless you specifically ask if they are doing self-harm or are they getting suicidal thoughts, they are unlikely to tell you that by themselves. So do not rely on passive reporting. When you see mood changes or agitation in a young adult or adolescent, please do ask specifically about suicidal thoughts and self-harm thoughts as well as actions. If you see undue risk-taking behaviors like doing drugs, indiscriminate sexual activity, I'm not referring to POXO here, but even that may need to be activated, or even stuff like driving recklessly, driving without license, drinking alcohol at home or outside, doing stunts, and all of that risk-taking behavior, then it is best to get a proper mental health consultation done. And now, the hack of which is bigger than all of them, which is the mabap of all the hacks, and that is art. It is a surprising entry, but it is definitely there. Art that requires action is usually phenomenal for your mental health. I'm not talking about severe mental health conditions like bipolar and schizophrenia, where actually art therapy helps as an adjunct. But in conditions which are at subclinical level, or when somebody asks you mental health advice, in absence of anything being wrong with their mind, they want to know something which will help them preserve good emotional response and good emotional health, then art should be your prescription of choice, right next to exercise. Only thing is that it is not about just seeing art, it is about participating in art. So reading may be your hobby, but contemplation is the action. You contemplate on what you read, or you write about what you read. That is art in action. All performing arts, we talked about dance, but all performing arts are fantastic stress busters, and they restore your emotionality, even help self-expression very well. Children who draw, paint, sculpt, or sketch typically give that up by the time they reach 6th or 7th standard, because parents say that now you must study, don't waste time in this, you can just pursue this as hobby once in a while. That is not true. A child who has that art in them must practice their craft every day. There is nothing better than that. The way to sell this to parents is that every minute spent doing art is a minute spent away from screens and social media. And about music, we know that a lot of kids, a lot of adolescents listen to music. Listening to music may be helpful, but making music has a very clear therapeutic effect. So the mabap of all the hacks for normal people or people with minimal symptoms is art and exercise. Don't ever forget that. Okay, that is pretty much all that I have to say on this topic. I hope the sharing has stopped. All right. Yeah. Now I'm happy to answer your questions.
Thank you. Thank you so much, Dr. Bhushan. I just want to know whether a group therapy helps a kid, like for adolescent, as in adults, say that they help by having the group therapy or a group session. So in adolescent, you want to give them private time, or group therapy is good?
So specific, you again, as I said in the beginning, that general counseling sessions have no value. In the same way, Children just sitting together and talking to each other, somebody facilitating that, does not have a great value. In fact, you will find that a counselors actually get scared in group therapy because children can become aggressive, they start competing with each other, and parents are always worried that they are actually learning tricks from each other. So the most effective platform or most effective indication for group therapy is actually interpersonal issues and anxiety reduction. Children learn cognitive behavioral therapy techniques to reduce anxiety very well in groups. Physical relaxation sessions are hugely helpful for group therapy. Obsessive compulsive disorder group therapy, particularly when there are repetitive behaviors, cleanliness rituals, group therapy can help there. And one of the most important part, which I would say is the golden thing about group therapy, is social skills training. Social skills training can only happen in a group. It cannot happen with a counselor or a psychotherapist trying to teach social skills in a clinic sitting across a table. Social skills are typically learned in a group. So these are very specific indications. See, in Western countries, they do group therapy even for borderline personalities, self-harm groups, and all of that. I haven't seen them working very effectively in India. In fact, there have been attempts, and sometimes the self-harm can get quite bad. Parents are actually right that children can learn from each other, and then the situation can get scary. They can get very competitive. The friendships that they form there may not be up to parents' choice sometimes, and then it all gets complicated. So unless we have a very specific, focused, planned work for that group, a generic group therapy will not help.
Okay, another thing you said, like art is an like maa-baap of all the therapies which we have. What I say that many children may have performance anxiety and may increase the stress. Is it like that?
No, it is Mahabharata of all the hacks, not of all the therapies. Because see, the thing is that the moment it crosses a certain threshold, the mental ill health, all our hacks are not going to work there. They're actually going to require proper assessment and treatment there. These are things which will preserve your sanity. These are things which will preserve the normality of human life. And art plays a very big part in that. See, today, just in Navratri, a lot of us are going to actually experience art. We are going to wear specific clothes, we are going to arrange, we are going to do decorations, we are going to do garba, we are going to dance, we are going to make music, we're going to have fun. And our mood is going to be significantly better at the end of Navratri. This is literally art. We are going to live art for next 1 week here, right? So this is what I'm talking about, not as a therapy. I'm not going to push a depressed kid to do garba and hope everything will be all right. But art as a normal, essential part of human being is something that we need to stress on when we talk to children, particularly because this art is getting eliminated from their life. You know, you do not see beauty in public life. You do not see beauty on the road. Everything is of same gray color. It is exactly of the same size, and it is all industrialized. Even the food does not look beautiful and colorful anymore. Okay, it is all smothered in cheese. So this is something that I'm talking about, that connecting with our basic artist inside, which everybody has, is a very experience. Children who are overburdened with studies, when art is taken out of their life, they actually suffer. So this is the important part for us.
Very beautifully answered, Dr. Bhushan, and I agree and appreciate the way you have told us about how art will be helpful. I would like, there are many comments in the chat box and appreciating your talk, and they are all very insightful, and they are saying that it's very important, great information, everything is good. So, do you want to give a one-liner message to our audience, like for
Dr.
pediatrics?
Jayashree, may I ask one
Yes,
question?
yes, Dr.
Yeah.
Gauri.
Yeah.
She is the president of Thane Academy of Pediatrics.
Good afternoon, Dr. Bhushan. What a fantastic, phenomenal, and very, very insightful. Every moment, I think we have learned something new. In this, I have just one comment to make. I think we have lost the importance of play, as in playing and art and music and dance in our everyday life. I think as maybe we need to inculcate it in ourselves also. But I think we have to get this message across to our parents, because it is all about competition and marks. I mean, maybe like what you have said, up to the 5th, 6th, 7th standard max, a child is allowed to take part in drama. But if that drama or the tennis lesson or the dance is impinging on the academic or the so-called tuition time, then that is just taken out of the curriculum of that child, or the extracurricular activities is only for tick marks. So how am I supposed to get this across to my parent, that how important is this for your
So
child?
typically parents, particularly parents of troubled children, have two specific worries. One is that their academics is going to suffer, and second is that they are going to be unfit in the wider world. And this is typically where play comes in. Okay, I'm differentiating it from sports. Sports is competitive, specific training. It's literally like you are creating soldiers. Sports has its own specific positive way, but play is an unstructured, creative play that we are talking about. So what happens in play, which should be of great interest to parents, is that children learn better emotional regulation, emotional expression, even their vocabulary increases, and actually they start writing better. Okay, so that helps a lot of parents. Second thing that happens with play is that children practice social skills, interpersonal skills, particularly if they are playing in a group and even in solitary play when they are playing out the themes. And these are two things which are very close to any parent's heart: emotional resilience, verbal and writing skills, and interpersonal relationships. So that is how play can be sold. As if you can see from there, this is my clinic and this is the playhouse that I use there. And that's a beautiful piece of art there on the wall, which is about 15 feet long and 12 feet tall. And I do a lot of play therapy. But unfortunately now, children older than 7 or 8 years are unable to participate in play therapy because they have no experience of free play. Just 20 years ago, 25 years ago, when I started practice, I could do play therapy sessions even with 15 and 16-year-old adolescents. Now I'm left to do play therapy only with children less than 7 years. So what you say about eliminating play from children's life, and we do that to our own detriment, I absolutely agree with you 100%.
Thank you so much. I tell one comment here. I tell my parents that they have to learn playground politics. In the sense, you need to know once in a while a leader, sometimes a follower. You need to know what is a no for an answer. So
Yeah.
I think that teaches us emotional resilience. I think is a phenomenal word, and that is what is going to take us ahead. Thank you so very much, Dr. Bhushan.
Thank you.
Madam,
Shall
can
we
I
move
ask one
ahead now?
question?
Shall we move ahead now, or
Dr. Ram Bharat wants to ask a question. Do we have time, Dr. Chitra? One
actually,
question only.
okay,
Yeah.
we can.
Good afternoon, sir. Dr. Ram Bharat from Chandrapur here. Sir, whatever non-pharmacological hacks you have said, how much time will it take to reduce stress? Because extremely sorry to say, but nowadays adolescents are listening like these comments: "एक कश लो सब भूल जाओगे stress. एक घोट घे सगळं विसरून जाशील." So in
Okay.
this, so how much time should we expect? Because everybody is behind quick fix now.
Yeah. So unfortunately for stress, there is no healthy quick fix like all healthy things. And the way I explain it to my patients is that you have fallen off a 20-storied building, okay, and you have broken your bones. So there is no magic which is going to get you back on top of that building straight away. But one step at a time, and we can reach why 20 floors, but even 25 and 30 and 50 floors. So healthy habits, building habits invariably takes time. Retraining the hormonal loops takes very long time. We are talking about months here. This is not days and weeks. We are talking about months. So yes, we are competing with those immediate temptations. But again, going back to the educational sessions that we talked about, that talking to parents and children together and talking about their particular stress fingerprint, which is unique to that particular family and that particular person, can motivate them a lot better.
Thank you, sir. Thank you.
Yeah,
Thank you,
thank you
madam.
very much. Thank you very much. Let us move ahead now. Thank you so much, Dr. Bhushan, for opening up the type. And our second speaker is equally able and achiever. Dr. Suresh Patil is practicing over a decade, working in Vasai and Nalasopara area and Vibhas Hospital. In addition to that, he is having 150 bedded rehabilitation center and de-addiction facility. He is having woman psychiatric hospital separate for women, Vishakha, a unique center and catering the needs of his women patients and women mental health. A sought after speaker all over the country, including AIMS, and having many innovative ideas to bring mental health issues closer to the community. In 2025, Mana Durga is one of them. It is by ladies psychiatrist and it is very popular. Welcome, Dr. Suresh Patil. Please start your deliberation. A silent struggle and shared solution. Dr. Suresh.
Yeah. Am I audible?
Yeah.
Slides are visible?
Your screen is visible, sir.
Yes, screen is visible.
Yeah. Full screen?
Side, yes, full screen.
Not yet.
Yeah.
Yeah.
Happy Navratri to everyone. A special happy wishes to all Navdurga of Upper Konkan. I'm telling Upper Konkan because it's not a Palghar Academy of Pediatrics, it's a Palghar, Thane and Raigad Academy of Pediatrics. I am dealing with the Upper Konkan. It's a good collaboration to have a talk with the psychiatrist. My childhood is hacked by cricket, especially Sachin Tendulkar. When the Sachin Tendulkar batting, now then everyone feel that their all memory, brain, mood, everything is hacked. Dr. Bhushan Shukla sir is our Sachin Tendulkar of child psychiatry. Once he bat, now it's a very difficult to bat. So today my responsibility is like Ajay Jadeja and Robin Singh to handle the middle order and try to finish. Okay. First of all, I congratulate the person
Dr.
who.
Suresh, you are the Virat Kohli of Vasai Virat.
Yeah. Vasai Virat Kohli, but the era is different. Sachin Tendulkar is Sachin Tendulkar. I congratulate the person who designed this title, The Silent Struggle and the Sad Solution. A title itself tells the many things. I come to the way I talk in general. Why this is a topic? As Bhushan sir rightly mentioned, is the third cause of leading death among the adolescents or young adults from the 15 to 29 years. Is coming to the second place. So suicide is one of the calamity. It's a preventable disease, preventable death. So we have to focus on the suicide today. Second is the incident in India is rising very fast, especially in urban and semi-urban area. And why to a pediatricians? Okay. Because the pediatricians are the first person come to contact with the kids, pupils. They are crucial role. They have a very crucial role to prevent the suicide. In the slide, I show the suicidal knot and the light. The pediatrician is that light, that is hope. The pediatrician catch the patient at the early interactions, early interventions, and started the intervention early now, we can prevent a suicide. Why it is a silent struggle? एक अंधे का सच है. For that, this is a silent struggle. Still, the mental health is a stigma and the shame in the India. आप बोलेंगे डॉक्टर पाटिल व्हाट यू आर टेलिंग अभी तो मेंटल हेल्थ सर एज अ भूषण सर मेंशन एवरी लेन हैज अ टू साइकोलॉजिस्ट और काउंसलिंग क्लिनिक्स but mental health apart from the counseling clinics and the psychology, mental health is understanding the mental health equal to physical health and the social health. The more important still now the physical health, because of that there is a lot of stigma and shame, and the stigma and shame cause a hidden suffering. What different about this stigma and shame in adolescent? Because adolescent rarely say directly. They are their own world. They are not connected with the parents, not connected with the doctors. They are connected with their peers. And many times they are not open. They are like atom bomb. कभी भी फट जाएगा, बट बिफोर फटने से पहले पता नहीं चलेगा. हियर आई एम शेयरिंग अ स्टोरी. 2 days before, one parent came to, mother was my old patient 10 years back. Okay. What they, for what purpose they come there? 13-year young son attempted suicide. They were here in Virar and shifted to Pune 7 days back, and suddenly, without any reason, he take jump from the 5th floor. Fortunately, uh, he was got injured. He was serious. He was ICU. Come out of this, but this happened suddenly. We don't know whether that boy is going to die or not. But these actions, these things are in reality. हमको लगता है क्या सब पिक्चर में दिखाते हैं, ऐसा कुछ नहीं है. But we are the daily life. We are dealing it. आप मेनी ऑफ यू रीड इन द न्यूजपेपर की 12 वर्षाच्या मुलांना आत्महत्या केली, शाळेतल्या मुलांना आत्महत्या केली. सो डेथ, suicides and deaths is a reality in adolescence. That's why we have to deal. Many times they don't want to die, they want to pain to end. They want pain. Many times they written in their notes, I just want to quit. I am frustrated. This is the end. No one is responsible. So they want pain to end, not though they want to end. They actually want to end their pain. So what is the epidemiology? Epidemiology is about, this is a statistic about India. This is I take from the Crime Bureau report. 7.6 per lakh in India versus 9 per lakh in the Western world or in the world. More in the adolescents, especially in the females. The committed suicides are in the females. The fourth leading cause of adolescent death in overall, more in the semi-urban and urban area. Now come to the point. I come to the point, what are the risk factors? The first risk factor comes from the family. The family or the conflicts are there, child abuse is there, neglect is there, addictions are there. This is the first risk factor. The second risk factor, as Bhushan sir correctly mentioned, academic stress. Everyone given importance to the marks. A lot of competition is there. Many boards are there. आमच्या लहानपणी फक्त SSC बोर्ड असायचा, तेवढाच सगळ्यांना सिलेबस होता, तेवढंच पुस्तकातलं वाचायचं. Now there are a lot of boards are coming, parental pressure is there, peer pressure is there. So academic stress is the second important reason. Third is the schools and colleges. These are the specially points for the bullying, especially schools and colleges, junior colleges, and peer pressures. So they carry the extra burden on the mental health. Many hidden psychiatric illnesses. ADHD is there, conduct tests are there, ODD is there. Many time early childhood depression is there. Even the schizophrenia and bipolar have onset in this adolescent phase. So hidden psychiatric illnesses is also cause for this suicide. Second is substance use. This is a upcoming cause. Okay. Especially weed is increasing rampantly in the adolescents. कि क्या होता है अल्कोहल एंड वीड्स एंड स्मोकिंग. सो सब्सटेंस इज वन ऑफ द कॉज फॉर सुसाइड इज दिस फैक्टर. क्रोनिक इलनेस, स्पेशली अगर कोई थैलेसीमिया का बच्चा है या क्रोनिक कोई कंपोनेंट है जिससे वो क्रोनिकली तकलीफ में है, दैट क्रोनिक इलनेस कॉज डिप्रेशन एंड दे आर मोर प्रोन फॉर सुसाइड. सेम लाइक disability cause a chronic depression, and chronic depression may cause risk factor for suicide. So these are the high risk factors for the suicide. Now we come to the warning signs for pediatricians. These are the very important. तुम्ही दररोज तुमच्या ओपीडी मध्ये पेशंट बघता. तो पेशंट लहानपणापासून जन्म झाल्यापासून तुमच्याकडे येतो. मग तुम्हाला त्याचा स्वभाव माहिती असतो, तुम्हाला तो पेशंट माहिती असतो, फॅमिली माहिती असतो. इफ यू नोटिस सडन चेंज इन द बिहेवियर, अरे हा तर हसता खालता मुलगा होता, हा का बोलत नाही आता, हा का गपचूप बसायला लागलाय, किंवा याचं बिहेवियर चेंज झालेलं आहे, किंवा एखादा मस्त छानपैकी हसना गाणारी मुलगी आहे किंवा मुलगा आहे आणि तो अचानक इरिटेबल व्हायला, चिडचिड व्हायला लागला, घरात पॅरेंट्सना त्रास द्यायला लागला आणि त्याच्या बिहेवियर मध्ये खूप इरिटेबिलिटी वाटली, किंवा सिंगल फॅक्टर ऑफ प्रेडिक्टिंग सुसाइड इज होपलेसनेस. होपलेसनेस अ सिंगल मोस्ट इम्पॉर्टंट फॅक्टर. जर कुठला मुलगा किंवा मुलगी तुम्हाला बोलली की मला असं वाटतं की जगून काय फायदा नाही, माझ्या आयुष्यात काय होणार नाही, किंवा आता सगळं संपलंय, आता माझं काय होणार नाही, दिस इज द हायेस्ट रिस्क फॅक्टर, दिस हायेस्ट इंडिकेशन की आता आपल्याला काहीतरी करायला पाहिजे. सो इम्पॉर्टंट थिंग्स आर द विड्रॉल बिहेवियर, इरिटेबिलिटी, होपलेसनेस. सेकंड red flag sign I can mention is a self-harm stuff. When you do a general examination, always check the hands of the adolescents. Many times there are scratch marks are there, register marks there. These marks are that showing that their inner pain. की त्यांच्या आतमध्ये असं काहीतरी चाललंय की they want to tell, but they were not able to tell to close family members or with the teachers. That time you can start the interaction by seeing this. You can check the hands. Many the young ganja and I can say the brown sugar addicts kids have the त्यांचे हाताची बोट थोडी जळल्यासारखी असतात. इफ यू ऑब्झर्व दॅट यू कॅन प्रोक देम की काय घेतो का रे, काय हे करतोय का. सो दिस इज अ फॉर ड्युरिंग युअर जनरल एक्झामिनेशन ट्राय टू सी देअर हँड्स. डिक्लाइन ग्रेड इज डेफिनेटली अ फॅक्टर. खूप चांगला हुशार मुलगा होता, 10वी मध्ये चांगले मार्क पडले होते आणि 11वी 12वी मध्ये एकदम फेलच झाला. दीज आर द साइन की त्यांच्या मेंटल हेल्थची काहीतरी गडबड चाललेली आहे. Frequent unexplained complaints, abdominal pain, headache, backache. When number of tests are done, all tests are normal. Still, that patient, that kid is suffering. Then you can have a alarming sign in your mind that this might have some kind of depression or some kind of psychological issues. Suicidal talk. This is very important. Whenever any kid from their side टॉक टू यू, डॉक्टर मला जगावंसं वाटत नाहीये, माझ्या आयुष्यात काहीतरी वाईट चाललेलं आहे किंवा मला काही चांगलं वाटत नाही, मला वाटतं की सगळं संपवावं. टेक इट सिरियसली. ठीक आहे, टेक इट सिरियसली. इट इज अ डायरेक्ट रेड फ्लॅग साइन दॅट यू हॅव टू डू समथिंग. These are the red flag sign I tell. Now what can a pediatrician can do? The first thing, that early detection. Finding the right candidate at the right time is a very important. If you find them at the right time, so during their visit, you talk with their parents, you can do a sessions, you can start a treatment, or you can refer. But early detection is very important. Ask sensitive question about mood and stress. फक्त पेशंटला स्टेथोस्कोप लावला आणि कागदावरती चिठ्ठी लिहिली असं काही संपत नाहीये. There are few things we need to carry during while checking a adolescent. You have to talk with them. त्यांचा मूड कसा आहे, काय स्ट्रेस कसं चाललंय, त्यांचं आयुष्यात काय चाललंय. दिस इज अ व्हेरी इम्पॉर्टंट. दे फॉर्म देअर सेल्फ इफ यू हॅव गुड बॉन्डिंग ना. आणि आय फाइंड दॅट अ पेडियाट्रिशियन आर द नंबर 1 डॉक्टर्स. त्यांच्या एवढं बॉन्डिंग कुणाशीच नसतं पेशंटचं. दे हॅव व्हेरी गुड बॉन्डिंग. अंकल अंकल, आंटी आंटी, madam madam, teacher teacher, sir sir. This kind of bonding they have. This is a very close relationship rather than psychiatrist close relationship. जेव्हा तुम्ही त्यांना विचारणार ना, दे विल डायरेक्टली टेल मला असं वाटतंय, बिकॉज दे आर नोईंग यू फॉर लॉंग टाइम. जन्मल्यापासून तुम्हाला बघताय, तुम्ही त्यांचे डॉक्टर आहात. सो आस्क देम अबाउट मूड ऑफ स्ट्रेस. Then whenever in OPD, if you have time, if you suspect something is there, you can use a questionnaire. PHQ-9 is a very important questionnaire. I will share to Jayashree madam afterward, so that you can check, make in the checklist and use in your OPD. How to ask about suicide? काय रे, सुसाईड करावंसं वाटतं का? You cannot ask ना, काय रे, सुसाईड करावंसं वाटतं का? तो म्हणणार काय डॉक्टर कशाला विचारतात मला असं, आई बाबांच्या समोर विचारतायत. सो टेक देम इन देअर कॉन्फिडन्स. नॉर्मलाइज त्यांचं लाईफ बद्दल विचारा, चर्चा करा, गप्पा मारा. मग डायरेक्टली त्याच्या मूड बद्दल विचारा. मूड मध्ये विचारल्यानंतर जनरली यू कॅन टिक काय वाईट चाललंय, काय काय डोक्यात काय विचित्र वगैरे काय. तो त्याच्या देन ही फ्रॉम हिज साइड बिकम ओपन. आणि इवन इफ इज ओपनिंग अबाउट समथिंग अबाउट हिज रिलेशन, इसका गर्लफ्रेंड है, बॉयफ्रेंड है, उसने अल्कोहल पिया, डोंट बी अ जजमेंटल. ठीक है, एक्सेप्ट इट एम्पैथिक वे. ठीक है, बिकॉज ही शेयरिंग, बिकॉज ऑफ ही कॉन्फिडेंट अबाउट यू, यू वांट टू कीप इट सीक्रेट. तो आपको लगा की बहुत डेंजरस है, देन यू हैव टू शेयर विद द पेरेंट. बट डोंट बी अ जजमेंटल. काय वाया गेलेला पोरगा, याचं काय होणार नाहीये. बिकॉज गॉड गिव्ह ऑपॉर्च्युनिटी एव्हरीवन. त्या पॉइंटला जर तुम्ही त्याला गाईड केलं, हिज लाईफ विल बी टर्न. बिकॉज मेनी टाइम दिस इज एक्सपेरिमेंटेशन what the kids are doing many times, because for the experimentation doing. And second thing, if the positive things you find that याच्या डोक्यात काहीतरी चाललंय, take it seriously. Ask him more about more details. What are the intent? Why is he doing? What is his plan? What are the means he are supposed to use? So we can prevent. So always ask about suicide. Whenever the adolescent you find a stress, you find that some unnecessary complaints are there, family background is there, a depression history in family or past history is there, always ask about suicide. Don't be a shy. You talk in this way, many times kids will open. Now the second part, first we'll see, second is a shared solution. What shared solution means? Problem is me and solution is we. So me problem, we everyone know. What we can do together as a psychiatrist, pediatrician, society, community, schools, That is a very, very important factor. What we can do, simple, accept it as joint work. माझं काम नाही, आम्ही पेडियाट्रिशियन आहे, आम्ही दिवसाला एवढे पेशंट बघतो, आम्हाला वेळ नाही, आम्ही NICU PICU बघतो. नाही, इट्स our shared responsibility. So unmask yourself. It's our responsibility to save the lives. So talk about the suicide, talk about the depression, talk about the anxiety. So unmasking ourselves and taking mental health is our work. It's a very important. Second important, whenever parents come with kids, थोड़ा सा लेक्चर देने का, सिंपल लेक्चर देने का. सो व्हाट लेक्चर आप देने का, क्या डोज देने का, कि लिसन मोर देन टॉक. आप अपने बच्चे की बात सुनो, उसको ज्यादा सुनाओ मत. अभी वो सुनने के उसमें उम्र में है. आप उसका जितना सुनेंगे वो आपका उतना बताएगा, फिर आपका संवाद अच्छा होगा, डायलॉग अच्छा होगा. सो पेरेंट को एक छोटा सा डोज देते रहने का, उसका सुनो, थोड़ा उससे दोस्ती करो, उससे मैत्री, उसके लिए एक मिनट लगता है हर एक एडोलेसेंट के पेरेंट को बोलने का कि ज्यादा सुनो, बात करो, अभी दोस्ती करो इससे. सेकंड की द मोस्ट सक्सेसफुल पेडियाट्रिशियन इज अ पेडियाट्रिशियन हु गो इनटू स्कूल. उसका प्रैक्टिस बहुत अच्छा रहता है. और स्कूल में जाना इज लाइक बीइंग अ शाहरुख खान. स्कूल प्रिंसिपल को ऐसे घुमाने का, बोलने का कि चाइल्ड का मेंटल हेल्थ इज वेरी इंपॉर्टेंट, उसका फिजिकल हेल्थ इज वेरी इंपॉर्टेंट, उसका न्यूट्रिशन इज वेरी इंपॉर्टेंट. मार्क्स को जितना इंपॉर्टेंस है, इक्वल इंपॉर्टेंस इज देयर न्यूट्रिशन, मेंटल हेल्थ, उसका सोशल हेल्थ, बिहेवियर. गो इनटू द स्कूल, एंगेज द स्कूल इन योर प्रैक्टिस. फिर 15 अगस्त 26 जनवरी को कभी ना कभी झंडा फड़काने के लिए जाने को मिलेगा, बट दिस इज अ वेरी इंपॉर्टेंट फॉर कम्युनिटी. प्रमोट योर पीयर सिस्टम. देखो, इफ यू वांट टू मैनेज बीरू ना, शोले अच्छा बनाना है तो जय को मैनेज करना इज वेरी इंपॉर्टेंट. यू नीड टू फाइंड आउट कि जय बीरू कौन है बच्चे के लाइफ में. इफ यू टैकल दिम एज अ जय बीरू, आई डोंट नो अबाउट ग्रुप थेरेपी, इंटरपर्सनल थेरेपी, बट व्हाट माय टैक्टिस की मुझे लगता है कि उनके फ्रेंड को कैच अर्ली, क्या चल रहा है ना, दे विल गिव द मोर इंफॉर्मेशन अबाउट देन द पेरेंट्स. कभी ऐसे लगेगा तो उसके फ्रेंड के साथ उसको बुलाने का, यू कैन टॉक विद हिम. फ्रेंड सब चिट्टा खोलता है, इसका ऐसा है, इसका ऐसा ऐसा है. दैट विल गिव मोर. सो प्रमोट्स पीयर सपोर्ट सिस्टम इज वेरी इंपॉर्टेंट. डिस्प्ले हेल्पलाइन नंबर्स. आपके क्लिनिक में यू कैन डिस्प्ले दिस हेल्पलाइन नंबर. किसी को सुसाइडल थॉट्स आता है तो आप ये हेल्पलाइन पे कॉल करो, दे विल हेल्प. मेनी पेरेंट्स आर नॉट अवेयर कि ऐसा हुआ तो क्या करना है. दिस स्लाइड ऑल्सो आई विल शेयर. सो आप उनको कॉल कर, इमरजेंसी में आपके हॉस्पिटल क्लिनिक में रहेगा तो पेरेंट कैन अवेयर एंड दे कैन टेक हेल्प इन इमरजेंसी. What are the protective factors? Definitely a family is I can say the shock absorber. So family warmth and supervision is very important. Healthy peer relationship is very important. Problem solving skills, resilience training, as Gauri Kulkarni madam mentioned, this is very important. Hobbies, sports, spirituality, and all the hacks Dr. Bhushan sir told us that they are the super, we have to follow it. And last, फुटबॉलमध्ये गोल केव्हा होते माहिती आहे का? राईट टाइमला जर तुम्ही पास दिला तर. इफ यू वॉन्ट टू बी अ सक्सेसफुल टीम ना, यू हॅव टू नो द राईट टाइमला पास कधी द्यायचा. सो जेव्हा तुम्हाला असं वाटेल की याच्या मनामध्ये ऍक्टिव्हली सुसाइडल आयडिएशन्स आहेत किंवा डिप्रेशन आहे, खूप मोठं मेजर डिप्रेशन वाटतंय, सिझोफ्रेनियाचे काही साईन वाटतायत किंवा ड्रग्समध्ये मुलगा आलाय, स्ट्रेट अवे यू कॅन रेफर. Where you can referral is very important in the suicide to the psychiatrist. Suspected depression, anxiety, substance use, repeated self-harm, repeated self-talks, a complex psychosocial background. Father has schizophrenia, father has addiction, family dynamics are there, divorce are there, multiple problems in family are there. So I know that pediatrician cannot spend that kind of time in one patient, but psychiatry can spend, because psychiatry have team of psychiatry can spend more time, and secondly they have teams. So complex psychosocial background you can refer to a psychiatrist. And when to refer, आपका कुठला psychiatrist मित्र असेल, त्याला वाटते की त्याचं देखील प्रॅक्टिस चांगलं हवं, definitely you have to refer. Management principles: ensure immediate safety, crisis counseling, therapy, medication, and follow-up. Last point, post-vention. Many times what happen now, patient do, a boy or girl do a suicidal attempt. After that now, that family and that kid is under stress. That time you have to support them. It's called post-vention. Prevent the contagious effect in peer. अरे इसने suicidal attempt केला होता, याना असं केला होता. This contagious effect you have to prevent and guide the teacher and the parents. It's our social responsibility to prevent suicide, not a doctor responsibility. It's a social responsibility. So be a team. We will work together. Practical tips for pediatrician today here is integrate screening in the OPD. Second is build a good referral network. educate parents about stress and digital hygiene, and promote healthy lifestyle in the teens. Take away notes. Suicide prevention is a shared responsibility. It's not responsibility of a psychiatrist, psychologist, or pediatrician. Pediatricians are the crucial gatekeepers. Silence is a danger. Open talk is healing. So be a voice that hear their silence. Be a voice that hear their silence. Thank you. Happy Navratri again. विठ्ठल विठ्ठल. You all surprised की डॉक्टर पाटीलनं काय विठ्ठलचं हे घातलंय. आय एम अ रायटर पोएट. मॅडमनी जर सांगितलं तसंच एक छानसा अभंग तुमच्यासाठी लिहिलाय पेडियाट्रिशियन साठी. मला वाटतं की तो अभंग मॅडम
Dr.
रीड
Chitra
करतील.
would like to read the abhanga you have written.
सरांचं हे रूप बघून आम्ही सुद्धा नतमस्तक झालेलो आहोत की एवढा फेमस सायकॅट्रिस्ट, एवढे त्याचे अचिव्हमेंट्स आणि इतकं सुंदर पद्धतीने यांनी आपल्याला जे आता भाषण दिलं त्याच्याबरोबरही अजून महत्वाचं म्हणजे त्यांनी सुंदर कविता पण केलेली आहे. मी त्यांची कविता वाचून दाखवण्याची जबाबदारी माझ्याकडे दिलेली आहे मॅडमनी.
ओळख करून द्या ना. कोण आले का? आले नाही ना.
आपण स्लाइड्स चालू ठेवायचे आहेत का?
नाही काढतो मी सर.
चालू ठेवल्या चालतील स्लाइड्स? बरं.
नाही नॉट नेसेसरी.
ही अभंगवाणी आहे आपल्याला डॉक्टरांनी आताच पाठवलेली. लहान घे जीव मन नाजूक फार, डॉक्टरांनो ऐका त्यांचा तो पुकार. औषधांसह द्या तुमचा हसरा चेहरा, मन होईल मोकळं जाईल अंधकारा. आई बाप येता संग पाजावा एक डोस, बोला कमी ऐका जास्त, हाच खरा संवाद. आणि किती पालक हे करतात जरा आठवून बघा. जोडा शाळा शिक्षकांची साथ, शिकवा कसा मिटवावा वाद. बालमन नाजूक घाला तणाव नियंत्रणाला साथ. आत्महत्येची लक्षणं ओळखा, वेळ नका दवडू, वेळीच रेफर करा, मिळून आपण आयुष्य घडवू. मी शहाणा असं न करता आपण आपल्या फ्रॅटर्निटीमध्ये या मुलांना पुढे पाठवायला हवं. बालपण गोड आनंदाचा मेवा, सशक्त तरुणाई हीच खरी भारताची सेवा, आपल्या देशाची सेवा. जाऊ दे दुःख सारे, तरच बाल डॉक्टर म्हणजे चिल्ड्रन स्पेशलिस्ट बनण्याचं समाधान भारी. जाऊ दे दुःख सारी, तरच बाल डॉक्टर बनण्याचं समाधान भारी. सुपा म्हणे क्लिनिक मध्ये जो हा अभंग गाई, तोच डॉक्टर प्रॅक्टिस मध्ये रोज प्रगती पायी. आणि हा मनाचा डॉक्टर आज आपल्या बरोबर इथे जोडला गेलेला आहे. शतशः धन्यवाद. फार सुंदर. डॉक्टर जयश्री, प्रश्न असतील तर सांगा.
खूप छान सुरेश, खूप छान बोलले. आणि मराठीत
बोल
सर, मराठीत बोलल्यामुळे अजून छान समज. छान.
आणि मला तुमचं नाव सुपा हे खूप आवडलं. खूप छान सर.
सुपा इज सुपर.
थँक्यू.
डॉक्टर, मला एक विचारायचं होतं की हे जे सुसाईड करणारे मुलं असतात किंवा एखाद वेळेस सुसाईड केल्यानंतर आपल्याकडे ऍडमिट होतात हॉस्पिटलमध्ये आणि ते रिवाईव्ह होतात परत सगळं, तर त्या पेशंटला अंदाजे काही लॉ मध्ये प्रॉब्लेम होतात का? म्हणजे हाऊ यू गिव्ह देम लीगल सपोर्ट? डॉक्टर म्हणून आपण मेडिको लीगली
नाही, अबेटमेंट ऑफ सुसाईड जो होता, जो पूर्वीचा कायदा ना, तो आता गेलेला आहे. त्याच्यामुळे कुठल्याच लॉ मध्ये काही प्रॉब्लेम होत नाही. पण जर सुसाईड अटेम्प्ट असेल ना, तर आपल्याला ऍडमिट केल्यानंतर पोलिसांना इन्फॉर्म करावं लागतं, कारण ते ऍक्सिडेंटल कॉज असतो ऍडमिशनचं. पण त्याच्यासाठी काय आता शिक्षा वगैरे काय नाही आहे. तो लॉच्या आहे ना, आता आपल्याकडे काय एवढा प्रॉब्लेम येत नाही. पण प्रॉब्लेम लॉच्या ह्याच्या नसेल ना तर पुढं जे येणाऱ्या ह्याच्यामध्ये असतात ना डॉक्युमेंटेशन इज अ व्हेरी इम्पॉर्टंट फ्रॉम आवर साईड ऑफ व्ह्यू, डॉक्टर साईड ऑफ व्ह्यू. जर ऍडमिट झाला असेल तर फ्युचरच्या त्याच्या अजून काही प्रॉब्लेम झाले त्याच्यानंतर आपल्याला डॉक्युमेंटेशन लागत असेल तर. पण अबेटमेंट ऑफ सुसाईड आता गव्हर्नमेंटने कॅन्सल केलं आपल्या लॉमध्ये.
दॅट इज व्हेरी गुड. आणि ऍक्च्युली ही माहिती सगळ्या डॉक्टर्सला अजून नाहीये, पण मेडिको लिगली वी हॅव टू इन्फॉर्म दिस.
आणि मेंटल हा मेडिकली इन्फॉर्म करावंच लागतं कारण ऍक्सिडेंटल कॉज आहे ते ऍडमिशनचं.
येस. आणि डॉक्टर विकास मोरेंना विचारायचा आहे प्रश्न. डॉक्टर विकास.
सर खूप छान तुम्ही टॉपिक इलॅबोरेट केलं. बऱ्याचदा असं असतं की आपण फोकस करतो मुलांवर की दे हॅव्हिंग सुसायडल टेंडन्सीज, पण समटाइम्स द चाइल्ड इज सो स्पॉइल की पालकांना सुसायडल टेंडन्सी अशी येतात कधी कधी पालकांना. म्हणजे आजकाल अशी मुलं आहेत की फॉर एक्झाम्पल दे आर promoting live-in relation, drug abuse. That things are gone in such a way that the parents are suffering like anything and they can't even express their feeling. आपलं कम्प्लीट चिल्ड ॲज अ पिडियाट्रिशियन आमचं फोकस कधी कधी चुकून मुलांवर होतं आणि वी समटाइम्स वी मे इग्नोर द इमोशनल रिक्वायरमेंट ऑफ द पॅरेंट्स. सो हाऊ टू हँडल दिस सुसायडल टेंडन्सी होलिस्टिकली टू फॅमिली ॲज अ होल?
सर गुड क्वेश्चन. द फर्स्ट थिंग इज दॅट ना आपण जर आता आंब्याचा सीझन आला तर डझनभर आंबे घेतले ना तर एखादा आंबा खरा निघतो. तर एखादा आंबा खरा निघला ना तर आपल्याला 11 आंबे वाचवायचे आहेत डझन मधले. तर त्या 12 मुलापैकी ना एखादा मुलगा खराब निघणार आहे, एखादी फॅमिली खूप सफर होणार आहे. तर त्या फॅमिलीच्या दृष्टीने आपल्याला प्रयत्न करायचा, पण 11च्या आधी आपल्याला काम करायचं. बिकॉज प्रिव्हेन्शन इज बेटर दॅन क्युअर. 11 मुलं सुसाईडकडे जाऊ नयेच म्हणून आपल्याला प्रयत्न करायचा आहे. आता जे गेलेले आहेत, जो एक खराब झालेला आहे ना त्याला परत मार्गात आणता येतो, वाचवता येतो, त्याला काही करता येतं का त्यासाठी करायला पाहिजे. दिस अ फर्स्ट पार्ट. सेकंड पार्ट ॲज अ पॅरेंट डेफिनेटली सुसाईड इज मी आमच्याकडे नेहमीच बोलतो की आमच्याकडे एकच इमर्जन्सी आहे ती म्हणजे सुसाईड अटेम्प्ट. तर सुसाईड मग लहान मुलाने करावी, म्हातारे माणसाने करावी किंवा तरुणाने करावी. सुसाईड इज अ इमर्जन्सी इन द सायकॅट्री. यू हॅव टू टेक सिरियसली, यू हॅव टू डील इट. आणि मी सांगितलं पहिल्यापासूनच बोलतो, इट्स नॉट अ पर्सन रिस्पॉन्सिबिलिटी, इट्स नॉट अ फॅमिली रिस्पॉन्सिबिलिटी, कम्युनिटी रिस्पॉन्सिबिलिटी. सगळ्यांची रिस्पॉन्सिबिलिटी आहे की आपल्या समाजामध्ये सुसाईड कमी झाल्या पाहिजेत. मग चांगलं कुटुंब राहण्यासाठी काय करायला पाहिजे, समाज चांगला राहण्यासाठी काय करायला पाहिजे, नीतिमत्ता चांगली राहण्यासाठी काय करायला पाहिजे, व्यसनापासून कसं दूर राहायला पाहिजे, याच्यासाठी आपली सगळ्यांची रिस्पॉन्सिबिलिटी आहे. बट वेन एव्हर यू फाइंड दॅट द पर्टिक्युलर फॅमिली इज न ट्रबल ना, तर आपण त्याचे रिसोर्स व्हायला पाहिजेत, आपण त्याचे हात व्हायला पाहिजेत, आपण त्याची मदत करायला पाहिजे. व्हॉट काइंड ऑफ हेल्प वी कॅन डू. मेनी टाइम द क्रायसिस इंटरव्हेन्शन डन बाय द फॅमिली इटसेल्फ. त्याची 4 फॅमिली टुगेदर बसले, त्याच्यातनं काही मार्ग निघाला. मग नॉट नेसेसरी प्रत्येक वेळी तो मेडिकल मार्ग असेल, तो तात्विक मार्ग असेल, व्यावहारिक मार्ग असेल, त्याचं काहीतरी प्रॅक्टिकल सोल्युशन असेल, बऱ्याच वेळा पोलिसांची मदत घ्यावी लागत असेल, लॉची मदत घ्यावी असेल, तर त्यावेळी अशा वेळी क्रायसिस इंटरव्हेन्शन इज व्हेरी इम्पॉर्टंट की आता जो प्रॉब्लेम आहे तो सॉल्व्ह करूया. इफ देअर इज सायकोलॉजिकल कंपोनंट की पॅरेंट मधला फॅमिली मधला एक माणूस डिस्टर्ब आहे त्याच्यामुळे अख्खी फॅमिली डिस्टर्ब आहे, सो यू हॅव टू ट्रीट देम अर्ली. जसं एखादा अल्कोहोलिक हजबंड आहे, त्याच्या अल्कोहोलमुळे सगळी फॅमिलीज डिस्टर्ब आहे, तो यू हॅव टू ट्रीट दॅट अल्कोहोलिक पर्सन. साइड बाय साइड ट्रीट द डिप्रेशन इन द वाईफ अँड होलिस्टिकली त्या फॅमिलीकडे बघायला पाहिजे. आपल्याकडे कसं होतं की मेनी टाइम ना अरे हे तर वाया गेलं आहे, याचं काय करायचं, याचं काय होणार नाहीये. सो डोंट लूज होप्स बिकॉज रेज आर व्हेरी इम्पॉर्टंट. आता सूर्य मावळला तर दुसऱ्या दिवशी उगवणारच आहे ना, तर आपण मावळला म्हणजे संपला असं नाही संपला. म्हणजे एखादी फॅमिलीचा तो पॅच असतो की दॅट टाइम दे आर डुईंग व्हेरी बॅड, आफ्टर दे आफ्टरवर्ड विथ द गुड सपोर्ट विथ देअर फॉर्च्यून दे कॅन कम बॅक.
डॉक्टर जयश्री मॅम, मी एकदा बोलू, एक प्रश्न विचारू?
येस येस डॉक्टर गौरी.
थँक्यू सो मच डॉक्टर पाटील. तुम्ही तो वारकऱ्यांचा ड्रेस घातला होता त्याच्यावर स्लाइटली हटके क्वेश्चन. डू यू फील दॅट थोडस रिच्युअल्स, रिलिजियस पेक्षा रिच्युअलिस्टिक किंवा सत्संग किंवा काही ते थोडस अर्लियर मुलांना इन्व्हॉल्व्ह केलं तर यू माइट हॅव अ लिटल बेटर आउटकम? I am not saying religion as such, but something where community मध्ये compulsory participation जर आपण as a family or as a society करायला लागलो तर ह्या गोष्टींचा which was म्हणजे I'm sure suicides earlier पण होते, maybe even amongst our peers, but they were not so rampant like what we are seeing, and it's a very scary situation today.
Madam, question is good. Thing is that now this satsang kind of spiritual thing, rituals are very important, which depend upon family to family. तुम्ही जर वीरेंद्र साहेबांना सांगणार ना तो तुम्ही राहुल द्रविड सारखं खेळा, किंवा जर तुम्ही राहुल द्रविडला सांगणार की तुम्ही वीरेंद्र सारखे शॉट मारा, दिस कम इन टू द नेचर. ते फॅमिलीच्या नेचरमध्ये असतं, त्या पोराच्या नेचरमध्ये असतं, त्याच्या समाजाच्या नेचरमध्ये असतं. ठीक आहे. जो ज्याच्या फॅमिलीनं घरी कधी आरती म्हटलेली नाहीये आणि त्याला जर तुम्ही सांगाल की आपल्याला स्पिरिच्युअल जगात द्यायचं आहे, तर ती फॅमिली बॅकग्राऊंड, त्याचा स्वभाव, या सगळ्या गोष्टी महत्व आहेत. व्हॉट थिंग्स आर इम्पॉर्टंट? स्पिरिच्युअलिटी डेफिनेटली, रिच्युअल्स डेफिनेटली याच्या मेंटल हेल्थच्या पॉझिटिव्हिटीमध्ये 100% फायदा आहे. येऊन सगळ्यांनी एकत्र ऍक्टिव्हिटीमध्ये येणं, सोसायटीच्या कार्यक्रमात पार्टिसिपेट करणं, दीज थिंग्स आर ऑल्सो इम्पॉर्टंट. पण आपण ते सगळ्यांना लागू करू शकत नाही. आणि व्हॉट वी हॅव टू टेन इज अ ग्रुप. म्हणजे पिअर प्रेशर कसं आहे त्याच्यावरती. तुम्ही जर तुमच्या कुटुंबातला वरचा जो मुलगा आहे, जो सगळ्यात मोठा मुलगा मुलगी आहे, किंवा तुमच्या सगळेच भावंडे आहेत, ते जर एका सत्संगला जात आहेत आणि तेच सत्संग ते करतायत, तर त्यांच्यावर ही मुलं लहानपणापासून जायला लागली, त्यांना त्याची आवड निर्माण होणार. पण यू कॅनॉट पुट देम एट ॲडोलसंट एज. नाही नाही, आता आता तुला जायला पाहिजे, इथे तू आता जाऊन बस. ते तुमचं ऐकणारच नाहीत. आणि तिथे गेले तर ते मोबाईलवरती खेळत असणार किंवा चुकून काहीतरी प्रॉब्लेम करणार. तर ज्याची जशी आवड आहे ना, त्याच्या आवडीप्रमाणे आपल्याला त्याला ट्रेन केलं पाहिजे. नॉट नेसेसरी रिच्युअल्स. त्याला स्पोर्ट आवडतो, स्पोर्ट खेळायला द्या. म्युझिक आवडतं, म्युझिक खेळायला द्या. ड्रॉइंग. तर त्याच्या आवडीप्रमाणे आपण त्याला ट्रेन केलं ना, तर जसं सरांनी सांगितलं, आर्ट इज अ माय बॉप ऑफ हॅक्स, तसं त्याच्या कलेप्रमाणे आपण घेतलं पाहिजे.
Dr. Suryakant Sankhe wants to ask a question. Dr. Sankhe?
पाटील सर, तुम्ही खूप छान हे सगळं समग्र आम्हाला माहिती दिलीत. माझा प्रश्न आहे की गेल्या 15 वड्यात आपण बघितलेलं असेल की पालघर डिस्ट्रिक्ट आमच्या शाळांमध्ये अशी पत्रकं आलेली आहेत, मानसिक स्वास्थ्य त्याच्याबद्दल तुम्ही शाळेमध्ये सरकारी अधिकारी येतील आणि तुम्हाला माहिती देतील. तर माझा प्रश्न या दृष्टीने आहे की औषध हे रोगापेक्षा भयंकर नसावं. कारण असं माझ्या पाहणीत आढळून आलं की जी मंडळी समुपदेशन करण्यासाठी येतात ते खरोखरच ट्रेंड आहेत की त्यांना 2-3 दिवसाचं काही पत्रकं दिलेली असतात, ते वाचून मग ते शाळेत येतात आणि पालकांशी संवाद साधतात. तर यात माझा प्रश्न आहे की कोणी समुपदेशन करावं आणि ते कसं करावं? कारण जर हे नीट प्रकारे केलं गेलं नाही तर मला वाटतं त्याचे परिणाम फार भयंकर असू शकतील. याबद्दल तुमचं मत काय आहे?
सर, खूप चांगला प्रश्न आहे. तर फर्स्ट ही थिंग द्या ना, एज्युकेशन इज लाईक वॅक्सिन. तुम्ही जसं व्हॅक्सिनेशन करता ना, तसं मुलांना एज्युकेशन हे वॅक्सिन सारखं काम करतं. आणि ॲट द राईट टाइम सायको एज्युकेशन असेल किंवा हेल्थच्या बाबतीत, आता मी जयश्री मॅडम, आम्ही नालासोपारामध्ये वसई विरार मैऱ्यामध्ये आम्ही हेल्थ एज्युकेशन राबवलं. चांगला मोठा स्कूलचा राबवला, तर ॲडिक्शनचा ड्राईव्ह राबवला. तर कुणी करावा हा खूप महत्वाचा आहे, कारण तुमचा कोच कोण आहे ना, याच्यावरती तुमचा खेळाडू तयार होतो. तर आता कसं होतं की आता पेव सुटलेत सगळीकडे. ठीक आहे. प्रत्येकाला असं वाटतं की तो सायकोलॉजिस्ट आहे, तो मानसशास्त्रज्ञ आहे. अर्धे आमच्याकडे पेशंट होतात की माझा जसं 10वीला मी पण मानसशास्त्राचा विद्यार्थी आहे, मी BA सायकोलॉजी करत होतो. तर समुपदेशन करण्यामध्ये 2 फॅकल्टी येतात. आयदर वन इज अ डॉक्टर. डॉक्टरमध्ये आपल्याकडे जे सायकॅट्रिस्ट आहेत ते ह्या फॅकल्टीचे मानसिक आरोग्याचे डॉक्टर आहेत. त्यांच्या ट्रेनिंगमध्ये, आमच्या ट्रेनिंगमध्येच आम्हाला हे सगळं येतं. त्याच्यामुळे ॲज अ सायकॅट्रिस्ट दे कॅन डू अ समुपदेशन. सेकंड इज अ क्लिनिकल सायकोलॉजी. तर क्लिनिकल सायकोलॉजीमध्ये MA केलेली जी क्लिनिकल सायकोलॉजीची मुलं असतात त्यांचं प्रॉपर ट्रेनिंग असतं. आता जे माझं हॉस्पिटल आहे, विभास हॉस्पिटल इज अ अपेक्स इन्स्टिट्यूट फॉर ए क्लिनिकल सायकोलॉजीची इंटर्नशिप सगळी माझ्याकडे होते. सो दे आर अवेअर अबाउट द टर्म्स, त्याची मेडिकल हे काय आहे, आणि त्यांचा प्रॉपर अभ्यास असतो. तर क्लिनिकल सायकोलॉजिस्ट फ्रॉम द रेकग्नाइज कॉलेज, आता NGO बिंजिओ मधनं पण होत आहेत कुठेही. म्हणजे आता तुम्ही ऑनलाईन बसून क्लिनिकल सायकोलॉजी डिग्री घेऊ शकता, त्याला काही अर्थ नाही आहे. तुम्ही प्रॉपर कॉलेज केलाय, तिथं कॉलेजमध्ये गेलाय, त्याचं प्रॉपर ट्रेनिंग केलंय, इंटर्नशिप केलेली आहे, किंवा मोठ्या हॉस्पिटलमध्ये तुम्हाला एक्सपिरियन्स आहे, असे जर काउन्सिलर आणि समुपदेशन असतील ज्यांना जाणीव आहे, शिवाय ते चांगले वक्ते आहेत आणि त्या विषयाची आवड असणारी आहेत, नॉट नेसेसरी डिग्री, फक्त डिग्री आहे म्हणून नाही, त्या विषयाची आवड आहे, चांगले वक्ते आहेत, त्यांना स्वतःहून त्यासाठी काय तर करायचं आहे, तर असे समुपदेशक 100% आपल्या शाळेमध्ये फायदा करणार, आपल्या समाजासाठी फायदा करणार. आणि अशा समुपदेशांना बनवणं पण आपली जबाबदारी आहे. जी चांगली मुलं जी शिकतायत प्रॉपर, त्यांना आपण ट्रेन करून, त्यांना सगळ्या ठिकाणी सायकॅट्रिस्ट पण जाऊ शकत नाही, पण ज्या ठिकाणी पॉसिबल आहे त्या ठिकाणी सायकॅट्रिस्ट पोहोचण्याचा प्रयत्न करतो. पण MA क्लिनिकल सायकोलॉजी आणि सायकॅट्रिस्ट दे कॅन कम एज अ आय कॅन से गुड समुपदेशक और गुड काउन्सिलर.
Pediatricians can do, I think, better job also.
Yes, pediatrician definitely, but pediatrician don't have time. Pediatricianची OPD सर, आता तुम्ही किती वाजता जॉईन झाले? 4 वाजता, 4:30. आम्ही 2 वाजता जॉईन झाले सर.
3:30
Pediatrician are super fast doctors. But pediatrician don't have time. Pediatrician definitely they have. मी समधी सांगितलं की बालक आणि पालकचं नातं आहे ना, पालक is a more pediatrician. Then we come to psychiatrist when come to issue of the mental health. You are equally equal level at the palak.
So we are the bridge
Bridge.
between patient and
Surely.
psychiatrist. Yeah. One very good course I have attended with IAP, ICP course, which is called as mental health counseling course, which is done through IAP and we get a certificate. So that's a very good course IAP is running. I think many pediatricians should join that course.
Yeah, thank you. Shall we move for the third speaker now?
Yes, yes.
Yeah, our third speaker will tell us about Heal Thyself. Mrunmayee Kumthekar. She is working in famous IPH, Institute of Psychological Health of Dr. Anand Nadkarni in Thane, and she's providing psychotherapy through REBT and CPT. She's master's, a bright student of SNDT University and a Ferguson bachelor degree from Pune. She's having REBT certificate course from Albert Ellis Institute of New York from 2017. An able and successful consulting psychotherapist with a special expertise in children, adolescents, and women. Welcome, Ms. Mrunmayee, and please start your presentation.
मृण्मयी बद्दल मला अजून एक सांगायचं आहे की मृण्मयी इज अ कोर फॅकल्टी इन दिस कोर्स विच वी हॅव डन इन फॉर द IAP ICP course and she has given this heal thyself heading or phrase from Holy Bible and she always tells that we are professional and many times we neglect our own self and it is like on the board when they say that put your oxygen mask before helping others. So, Mrunmayee, we want your help. Thank you so much for joining.
We cannot see your presentation. We cannot see your screen, Mrunmayee.
Pallavi madam, please make Mrunmayee co-host so that she can share the screen. Pallavi? I think I'll call her.
Are you able to share your screen, Mrunmayee? I think her connectivity is also an issue, probably. Yeah, she is not able to hear. She has written. I think the connectivity is the issue.
Ma'am, her connectivity is the issue.
Yeah.
We need to ask her to rejoin. Mrunmayee ma'am,
Right. Okay.
we
Okay.
can
In between,
share in the chat.
anybody having any inputs, you can go ahead.
Kindly call her and
Yeah,
ask
yeah,
her to
I'll
rejoin.
call
Yeah,
her.
I have done this and she will leave and then again she will join.
Yeah, ma'am. Thank you.
Till that time, Anjali, you want to share your experience with any psychologist or any patient? Because recently I have seen a 9-year-old boy who used to come to me with recurrent abdominal pain. And I think third, fourth visit, there was after investigation, nothing was seen in his reports. One thing when I have asked the family history, recently his mother has changed her religion and she was visiting church and everything and that was his trouble point. How to counsel in this patient is a issue. So we have to refer this patient to a psychologist, and then he is doing slightly well. Since 1 month only is visiting, but he's doing better now. Do you have any experience in this case, such cases?
Yeah, I have an experience. A very young boy, 18-year-old boy, his parents had changed their religion.
Okay, can you hear me?
Yeah, we
Yeah,
can hear
Mohanbhai.
you.
So shall I go ahead?
Yes. Till
So
that
this
time,
You all
Mrunmayee-
can hear me, right?
Yes.
Yes, Mrunmayee. So that 18-year-old boy didn't want to change his religion, although his parents had, but they were forcing him. And he told his mother that I don't want to. His sister ran away to Pune. This boy was still forced by his parents, and ultimately he committed suicide. So yes, we have to take these adolescents very, very seriously. He kept telling his mother, his mother knew that he was warning her that I don't want to, I'll do something bad with myself. So I think parents should not force, and this boy was 18 years old. So like Dr. Bhushan said, this is such a risky age. And so there was so much of stress and there was so much of force. So and I didn't even know about this. She was a staff working with us. So
Oh.
such is the pressures on adolescents. I'm done. Yeah, Mrunmayee can start.
Mrunmayee, you can share your screen. You are muted, Mrunmayee.
Muted. Please
Ma'am,
unmute.
yes. Ma'am, Mrunmayee ma'am, your second ID is also closed now. Kindly unmute yourself.
Okay. Sorry for the inconvenience and thank you for bearing with me.
No issues. You
Ma'am,
have two
ma'am,
devices now.
Yes,
Yes.
your second device should be muted.
Yeah. So the second device is on mute.
Okay,
There was
thank
some
you.
issue, but thank you for bearing for that. First of all, thank you so much for this opportunity. I will share my screen so the PPT will be seen. Okay. Yeah. Okay, so thank you so much for this opportunity. I have been given a very
We are not
interesting
able
topic.
to see your screen. Mrunmayee, we are not able to see your screen.
Shouldn't
You
happen.
have shared your screen, but the slides are not seen.
Slides are not seen.
Yeah.
I think it's
Now open that.
little slow.
Yeah, might be.
Mrunmayee, you can put off your video. That might increase your bandwidth.
Okay.
Yeah.
Yeah, I think it's opening up. It's a lot slower than expected for some reason. Yeah. Okay. Okay. I hope everyone can see the
Yeah, we
screen
can
now.
see, but make it full screen.
Yeah. So the screen will go full screen in a sec, I think. I will start up first. The healing thyself. Why healing thyself is important on that part. Because working as medical professionals for all of you, I understand it is important to work on or to manage your own emotional distress or to manage your own emotional regulation, because at the end of the day you're dealing with human beings, you're working with individuals, and when we are in better emotional state we are able to be more productive, we are able to share a lot of things in a better emotional state with the person sitting in front of us. So, in healing thyself, when I researched a little bit about this topic, working as a medical professional has its own challenges and demands coming up. Um, the screen is going at a little late, yeah. So, working as a medical professional surely has its own limitations and demands. As pediatricians, for all of you, it is high emotional and cognitive demands at work. You're dealing with lives, you're dealing with individuals. And when I actually researched, it showed me that almost 50% plus pediatricians face burnout due to their professional aspects of their work. I think it's part and parcel of being a medical professional, but managing it is equally important. It often leads to a lot of higher emotional exhaustion as well, such as the chronic stress that one experiences. Because apart from the professional life, you have your personal life, you have your personal challenges to deal with. There is often a decision fatigue too, because your decisions are a lot dependent on how it goes ahead. So that is there. There is a lot vicarious trauma that one faces due to the uh, uh, difficulties or challenges explained by the client, emotional exhaustion, burnout. There are multiple aspects of it. And there are most of the time physical symptoms as well. Physical symptoms as headaches, sleep disturbances, muscle tension, multiple parts. So when I say healing thyself, in healing thyself, I think it is utmost important to know that we can't pour from an empty watering can. If we want to help someone, if we want to help someone grow in their physical health, emotional health, we need to make sure that we have good emotional state of our own, good mental state of our own. Now, challenges.
Mrunmayee, your slides are not moving. Hello, Mrunmayee?
I will share again. I will share again. Just,
I think again we lost our connectivity.
it shows a good Wi-Fi to me right now. So it shouldn't be actually showing a lot of issues.
I think
Why don't you just start talking?
yeah, I think we can go ahead without the
Yeah, that is okay.
Mrunmayee, if you're comfortable, then we can go ahead.
Yeah, I think I can do that.
Yeah, please go.
This is good. Actually, small slides are okay for us. No
Yeah.
problem.
Yeah,
Yes.
yeah. Okay, thank you so much for accommodating. So I think the challenges faced, as we discussed, they are on emotional level, they are on physical level. And being medical professionals, especially for developmental pediatricians, there are certain aspects of the work which I think most commonly one struggles with, such as long working hours. I'm pretty sure all of your OPDs are always packed. It starts very early, it goes very late. So that is one part of it. Heavy workloads, especially, that is something that you often deal with. High job demands, and in contrast to it, the control over it is at times limited. Long wait list, complex cases. So there are multiple aspects to it that as a professional, you might have minimum control over. Now, when I generally say, or when I'm talking about healing thyself, it does not talk about a very rosy picture of life of everything is going to be great and you should not be having stress at all. But the key is of emotional regulation, key is of stress management. So I'm pretty sure all of you know these two important words called distress and eustress. So distress is any kind of stress that hampers in your day-to-day activities, that hampers in your proficiency, your productivity, and other life areas. Now, as a medical professional, if you don't have stress at all, you're not even likely to push yourself, you're not even likely to consult with another professional, work on your cases. So the optimum amount of stress required for an individual to function is actually called as eustress. Now, when we say healing thyself, when we say managing our emotional stress, managing our disturbances, what we actually mean is not going to distress, but maintaining our stress to what we call as an eustress, where you're able to work, where you're kind of pushing yourself also, where you're optimizing all of your abilities to address different life areas, may it be professional, may it be personal. I actually use this thermometer at times with adolescents or kids. That how we measure our temperature, it is good to see what is the temperature of our emotions. Now, if it goes too high, that means we are going on distress. If it is on the mid or lower end, that means we are on eustress. So I think it is a wonderful tool to check on that in terms of distress management where we are at. And I think the most common question asked is the question of how it can be done or what are the different ways it can be done. And I think it starts simply with the idea in terms of the approach we have towards our challenges. Now, this approach also means focusing on factors within control rather than focusing on factors beyond control. For example, if I have a very long OPD and I'm focusing on factors beyond my control, I'll be hell bent thinking about, oh, these long OPDs, okay, why are these clients have come today only? Tomorrow my OPD is free. What is wrong with people? And my stress or my irritation is going to go high. But if I'm rather focused on factors within my control, okay, that what can I do about this OPD hours today? What is it that I can manage today? What are the things that probably I'll have to convey to my receptionist, clients? Then the intensity of my irritation or the intensity of my stress that comes out of it is likely to be on the lower end. Even when we are facing the challenges, we also tend to awfulize a lot. We also tend to catastrophize how bad the situation is going to be. So I remember in the last lecture that
जेव्हा
I took,
लागते तेव्हा अर्जंटली लागत असते त्याच्यामुळे त्या गोष्टी ठेवा.
in my last lecture that I took at the Navi Mumbai Zuinagar Center of Indian Academy of Pediatrics, one pediatrician told me that she had a very long OPD, and in between her son called her, telling her that I miss you at home, you're not there at home. And I found that to be very interesting because she said after that I was not able to focus on my OPD properly because I was in a complete guilt. Now it is a stress, it is part and parcel of work, but it is also affecting, that stress is also affecting her OPD, that stress is also affecting her professional life. Now, when we looked at it, we said that what if we look at it a little realistically, that okay, this problem has occurred, but what are the different alternatives we can generate for this situation? What are the different options that we can generate? And collectively, everyone was able to come up with so many different alternatives that maybe after I go home, I'll spend extra time. Or maybe on the weekend, I'll make sure I don't have OPD and I spend that time with my child, or I explain my child what the situation is. Whenever we catastrophize, whenever we awfulize how bad the situation is going to be, the stress is likely to be a lot on higher end, which also does not mean to trivialize the situation. Another two approaches which I think are very important are also to focus more on the problem than blaming the person sitting in front of you, blaming oneself, blaming family members for that matter. And many of the times, in terms of our stress, if we see that the stress comes from the disruptive behaviors of our clients, or the stress comes from the disruptive behaviors of our family members and not from the person directly. For example, you have a client in front of you whom you have, for whose child you have prescribed some medicines, and the client says that these medicines are not working and this is not working at all. We came to you with high hope and nothing's working. Now, if I'm focused on the person, I would think to myself, what is this person? I'm being so nice. I've given medicine and this person doesn't even understand importance of a doctor. He knows more than me or what. Again, my irritation, my stress is likely to go on a higher note. But when I am focused more on the behavior part, that okay, right now his behavior of being arrogant with me or shouting at me is something that I'm not appreciating. But I am not upset with the person because that person has come to me with some of the concerns, some of the issues. So I'm not upset with the person. Immediately, my stress changes. Immediately, the intensity of it changes. So these 4 or 5 factors which I have shared, if you look at it, these are more of approaches that we can have as individuals to address our day-to-day scenarios. And in these approaches, they are more of what you can do at a cognitive level. But along with it, something very, very important that has come out to be very efficient, especially for medical professionals, is the practice of mindfulness. Now, I'm pretty sure there are almost 30 of you who are attending this session, and all of you individually would have your own ways of dealing with your stress. Some of you might be meditating, some of you might be listening to music, some of you might be drawing. But there are certain practices of mindfulness which have come out to be more efficient, especially for medical professionals. And these are the practices, these are the techniques which would come in very handy, especially even when you're in your OPDs, it is stressing you out a lot. Now, something very important, I think, is because as a medical professional, the job at times can be a little sedentary. You're in your OPDs for 6 hours, 7 hours, I'm sure at times more than that. Mobility is something which often helps us out deal with the problem differently, deal with the situation differently, kind of lower our stress in that moment. So a simple walk around your clinic, simple walk if possible outside your clinic is something that often helps us refresh our mind, look at the situation differently. But there are some things which are very interesting. So, mindfulness is basically being able to be present in the current moment. Generally, if I have more time and if it's an offline session, I do take mindfulness activities as well. So, what does mindfulness activities mean? Is observing the situation, observing the things, but not really evaluating them. To just give you all an example, in your OPDs, you often would have a pen in front of you. So, to look at that pen mindfully means observing the pen, observing the color of the pen, observing the shine of the pen, but not evaluating that, okay, this pen has gone bad, now I need to get a new one. Or this pen is my lucky pen, I should just stick with this pen. Mindfulness is basically being able to be present in the current situation. There are parts to it which are about mindful walking, mindful eating, mindfully breathing. So as you breathe in, you just focus as the breath you are inhaling and you focus as it is exhaling. These are the simple to do activities which can be done in that moment, in that situation. Along with it, there is, I'm sure some of you would be knowing about PMR, which is progressive muscle relaxation. Now, again, these are the techniques which can be done or which we call as symptomatic relief techniques. which can be done in that moment to lower your stress, to calm yourself down in that moment. There are simple techniques such as grounding technique, box breathing technique, which often can be done at the start of the OPD, which can be done at the end of the OPD to relieve your stress, to make sure that your burnout is not very overwhelming for you at the end of your day. When we talk about these to-do techniques of mindfulness, there are often multiple apps available on the our phones on Google, which you can use to give you a reminder, which often gives you an insight into how this mindful activity can be done. So there is this interesting app called MoodFit. This app has a bell ring to it. So every time the bell rings, you inhale, and every time there is another ring of the bell, you exhale slowly. So we can use technology for our benefit for sure. Now, something very important about the mindfulness activities is that mindfulness activities work when we own up to our stress as well, because often we believe that our stress is because of someone else. Now, something that we own up as ours, that is the only thing that we can change. If you don't like what you have cooked, or the tea or coffee you are having, you can make sure that you have a new one. But if you don't like what is getting cooked in your neighbor's house, you cannot do anything about it. So it is very important to know, it is very important to understand that the stress can be changed, the stress can be worked upon only when we own up to it, that, okay, this is my stress, this is my burnout, and there are these certain things that I will have to do about my stress, about my burnout. So, when talking about this, I had two ideas in my mind. First of all, is the approach that we can have, especially when we face these common challenges, when you face these common difficulties for that matter, and some of the to do things that you can do in your practice, which would either help us reduce our stress or come down to eustress from distress. Yeah, if anyone would want to add anything, anyone wants to share anything, or any question you have, I would be happy to answer that. Again, I'm sorry for the glitch it caused, but I'll make sure I share this PPT and it reaches all of you. So you can refer to it whenever you want.
So when can we talk to a psychologist and when should we talk to a psychiatrist? What is your opinion?
So I professionally and personally do believe that first of all, reaching to a mental health professional is the first and most important thing. Why? Because at times we would have this maybe professional or personal hindrance at times, that, okay, I am already a medical professional. How could I have these difficulties? So all humans can have these difficulties. When to go to a psychiatrist, especially when your difficulties, or when your emotional distress, when your burnout has started affecting basic areas of your life. So it has started affecting your sleep, when it has started affecting your appetite, uh, all the ADLs are not functional, so you're not able to do the basic activities. Your mood has been a particular way for a very long period. I think it's a time that you consult with a psychiatrist. For a psychologist, I do think that sometimes our challenges are not that big. So it has not affected your ADLs, it has not affected your health, it has not affected your sleep or appetite. But there is a small challenge, such as I struggle being assertive with my patients, or I struggle it when my patient gives a very bad feedback, I go completely low on my confidence. These are the moments which are very specific, which are situation specific, client specific. These are the times you can consult with a psychologist. I think something very important is if you struggle with work life balance. And I think it's a good time to consult. But what happens that many a times we think that, okay, I will manage it on my own, and it reaches to a moment when it gets very severe. So what we all call, when it reaches to a disorder level, we think, okay, now let's go. But we don't have to wait to reach it to a disorder level. Early on, if we go and consult a psychologist or a therapist, I think it helps us prevent that disorder level.
Very nice. But many high-end performers like movie stars and all, they always go to a psychologist, and they have their
Yeah.
own personal psychologist nowadays who are IT professionals or even achievers. So what is your
Yeah.
take on that? So do every
I
person
think
should talk to a psychologist?
I think, uh, first of all, if you have a counselor, if you have a psychologist with whom you are consulting, it is a great thing. Second, the interesting part about psychology is it is not only limited at managing distress, but it is also aimed at development. Hmm? So if you go to a psychologist, it does not necessarily mean that you are bad at something. But if you need to develop certain skills, if you need to have certain aspects to your life which you don't have currently, even in those areas, a psychologist can help. So, for example, I need to learn more empathy. I need to be more forgiving to people around me. Now, these are the techniques which are not aimed at distress management, but which are aimed at developing the personality entirely. So I think it's wonderful if most of the people do consult a psychologist, but not everyone does. So at least we say that at least at a distress level, if you think that something's bothering you, you're not able to handle it on your own, it's a good time to consult a psychologist, at least for that area.
One important hurdle between a psychologist or psychiatrist is that the number is very less as compared to the demand. The number of psychologists and psychiatrists is very less. So how can we like bridge the gap? Should a course like this, which we have done, is helpful? It's only the awareness which they have created. We are not yet able to do counseling as our own.
Yeah, yeah. I think, first of all, awareness is where it all begins, to know that these are the areas which could be addressed. But along with it, as a pediatrician or as a medical professional, there are certain things that you can share with the client, with your patient, or there are certain informations that you can share with, or the basics of empathy, basics of active listening, because these are the parts of the doctor-patient relationship. So even when you're not conducting a therapy session or a counseling session, I think these are the most fruitful things of any therapeutic alliance or doctor-patient relationship. But apart from that, yes, probably certain specific areas such as major disorders or certain behavioral techniques, cognitive techniques, you might not be able to share. But at least taking your patient to a point where the patient thinks that, okay, now at least someone listens to me, now I need to know more details of it. It's something that can be done. And if you think that you would want to know more techniques of it, you would want to know more strategies of it, there are these wonderful courses that you're doing, and there are other options that one can always avail with.
Mrunmayee, you are very good in REBT, I know, and it's very difficult for you to tell us about it in this short session. But can you sum up or why we should do REBT course? Can you tell us why every person
Yeah.
should have
So,
insight about that?
So I'll give you a crux of REBT. So everyone would gain insight what is it about and how it could help you all. REBT's full form is Rational Emotive Behavior Therapy. And the crux of it is that you're not disturbed by the events, but you're disturbed by the view that you take on those events. For example, all of us faced COVID. Everyone in the world faced COVID, but everyone had different reactions to the COVID. Probably as medical professional, you had exhaustion towards COVID. Some people were very happy that they were able to be at home. Some people were very angry about it. Some people were completely careless about it. Now, even when the COVID was same, people had different reactions to it because they had different perceptions about it. What REBT says that if you change your perception, or if your perception about the event is rational, then your emotional disturbance will be lower. And how it would help you all probably as medical professional is that sometimes we know that we can't change the patient or we can't change the situation, and it often leads to being disturbed, being irritated about something. So what we can do, what we can check with is, if we change our perception, first of all, does it lead to any different level of stress for us? And if we are able to convey that to patient as well, probably the patient's distress also changes.
Thank you. Thank you so much. Dr. Gauri wants to ask one question.
Yeah,
Dr.
sure.
Gauri?
Hi. Hi, Mrinmay. Thank you
Hello.
so much. What an insightful thing. And I truly believe, and I have been saying this, I think we used to say that it's only the West that all of them go to shrinks. But I truly believe that we should have, because maybe earlier on, society was such that you had counselors who were unnamed as counselors in your families. But I think it may make more sense for us to at least have a counselor once in a while, because it's always a work-life balance. And like you mentioned, now we are older, our children are older, but there were times when it was so difficult, when there was emergency in the house as well as outside, and you had to make the choice. In the earlier times, the choice was always going outside because you were setting up your practice. So my daughter would tell me, how you speak so sweetly to the patient, but when you're talking with me, when she was a kid, you never have the same tone. So because we always take them for granted. And a large number of us, I'm sure, are very lucky to have extremely supportive families. But there would be few of us who have to manage that also. Especially maybe as lady professionals, pediatricians who attend night calls, colleagues who attend night calls. It's a difficult thing. So work-life balance, and then you get angry, then you get upset, and you do not know the reason why. So maybe what you said makes more sense, that all of us should have a counselor, a friend in need, before we go on to a place where we might have to go to a psychiatrist, which also is not never a taboo. I think my children taught me that the younger generation is more accepting, that like you have a physical illness, you have a mental health issue. It's okay. Because
Absolutely.
it's difficult. Our generation, difficult to accept that. But I think it's been very, very a relevant talk and an eye opener in so many which ways. Thank you very much.
Thank you so much. Thank you. And my genuine apologies to the whole group. Due to the network issues, the slideshow caused a little disturbance. But I will share the PPT with the authorities, and she can forward it ahead. No problem.
Yes, please share the PPT as well as your contact number and details, so that anybody who is in need will be able to communicate with you. I now request Dr. Vikas More, sir, President IAP Raigad, to say vote of thanks.
Thank you so much, madam, for giving the opportunity. I will certainly require the help of Mrinmay, madam, in the CIP elections, because so many friends are simultaneously standing for the election. So you get even while attending the CME, I got so many calls. Please, मुझे vote कर देना. So whom to vote? So even a pediatrician is also very vulnerable, especially during the CIP elections. And what a wonderful whole presentation. As so many experts talking from hormones like Dr. Bhushan Shukla sir, then Suresh Patil sir, and as Mrinmay madam,
she is so sweet while talking also. The patients must be very happy to talk with you because a counselor should be smiling all the time. You should not be with a what I feel so because if you are if I feel happy while looking at you as a counselor, then uh, that counseling session is successful. I feel so. And the way the peculiar thing which I noticed is all the psychologists are very mature in handling uh, the emotional need of even the Zoom attendees because they know how to engage them. So all these three speakers have engaged us for 2 hours, last 2 hours. Very nice because I rarely attend the Zoom session in the afternoon time. First time I attended for 2 hours in a row because you are really, really brilliant. And secondly, especially Gauri Kulkarni madam, she's also so smiling. I was watching her. She must be very sweet pediatrician. Thank you, madam. I think for the first time, IIP Raigad is collaborating with Thane Academy of Pediatrics. Our Dr. Mohit Moitis has a very high regard for Thane because Thane has a very great track record for academics. He always gives example that नहीं हमको ठाणे जैसा बनना है, ठाणे जैसा बनना है. So we dream to be like you, madam. Is a compliment from our branch. And Palghar Academy Pediatric is a sister branch because these two sisters have brought us together, Chitra madam and Jayashree madam. They always take us together for so many activities. Lastly, the Maha AHA, who is blessing us throughout the last few years, they support us for doing all these activities, and especially all those seniors who have joined, especially Anjali Gokar madam, Joshi madam, for their attendance and their guidance, and the very wonderful questions being asked, and they were quite thought-provoking and they added the value to the content. So this content is going to be there on the YouTube. So please refer them and it will be definitely helpful for you. Sagar Wag sir, thank you so much sir for from Nagar he has joined. Please, before we close, please
Thank you,
give your some comments. How was the session?
Yeah. Thank you, everyone. It was very informative and nice sessions. Raigad, IIP Raigad, IIP Palghar, they are conducting the journal sessions. I'm listening to the sessions also. And this is the first, I think so, the district groups which conduct themselves for the Zoom meetings, and they in collaboration with the Maharashtra Academy of Pediatrics, they have their own sessions. So it's really very great to see the all the speakers and all the whatever the new presentations you have. So thank you for the presentations, and we look forward for you. Thank you.
Thank you, Dr. Sagar sir.
Yes, sir.
We also request Dr. Gauri Kulkarni madam to have her comments with this session, and I am really blessed to have
Thank you,
all
madam.
of
Thank you so much, madam, for allowing me, ma'am.
Yes, thank you, sir.
Thank you, Dr. Jayashree. As President of Thane Academy Pediatrics, it has been an honor and a privilege to collaborate with IIP Palghar and IIP Raigad, the first of its kind, especially for an online session. And it has been an eye-opener with every moment, which is, you'll have given us. Dr. Bhushan Shukla sir, Dr. Suresh Patil, it is so relevant to today's world which we are living in. It's a difficult world, but with seniors and with guidance of experts like this, I think we will be able to negotiate our roads better. And thank you, Mrunmayee ma'am, also extremely throwing a lot of light on a topic very close to our hearts. At this juncture, we're all pediatricians who are here, so let me take the opportunity, Dr. Vikas More, that Thane Academy of Pediatrics, as you said, academics has always rocked. On the 5th of October, I will put it up. We have a Thane allergy symposium. We call it as tapas. Chote dose mein ekdam bada dhamaka. We've got so that's what Spanish tapas means, small doses. So we have Dr. Vijay Vara, we have Dr. Vikram Patra, and Dr. Sitesh Roy, along with Dr. Ravikant Jhala from Panvel. They are going to be coming along. We have our own 3 experts. I invite all of you to attend our physical CMEs on
Madam, when
second
it is,
Wednesday.
madam?
Sir, it is on 5th of October. It's a Sunday. It is in a restaurant.
Okay.
Yeah, it's a hotel in Thane, Vihang Inn. And I will in fact personally post it on this group. Maybe I can put it up. It is a half-day session from 8 in the morning. It is registration, breakfast, and then from 9 to 2, we have the session with 4 outside and 3 our own faculty. So,
Okay,
yeah,
madam.
it's going to be a very interesting session only on allergy, pediatric allergies. So
Yeah. I'm also working as a pediatric allergist, madam. So
then
I just
please, we would love to have you also. So as an audience, so you can give in your own comments, and we are always learning. So it would be great. I will send this to you personally once I get your number from Dr. Jayashree. And we also have our SAN conference. That's later on. All of you are invited every second Wednesday of the month between 2 to 5. We have our academic CMEs at Fortune Hotel. So it's always great fun. And thank you, Jayashree and Dr. Chitra, for giving us the opportunity. Thank you, Dr. Vikas More.
Thank you,
All
madam.
the experts. Thank you. And mental health, the need of the hour for all of us also. So
Before we close, madam,
collaboration, and we will continue such collaboration henceforth. Please visit Thane on 5th October, because it's a really good CME, and we have been conducting this online CME every 4th Wednesday since last 5 years, and we would like all of you to attend such CMEs and also collaborate henceforth.
Yes, sure.
Yeah.
Yes,
Before
Dr.
we
More.
close, madam, we have a module on coming Sunday in Panvel in Garden Hotel. It is a pediatric zoonotic disease, and we have none other than Dr. Mahesh Kore sir as a faculty, along with Anish Raut sir and Monil Mohammed. So from out of the state, inner state, so we are getting very great faculties. There are only 40 seats for this workshop, so I encourage to register for this workshop as much as possible on pediatric zoonotic diseases. So you will relish good food, good venue, and great faculty. You will enjoy it.
Great.
It is free, but registration is compulsory. You can register on my personal mobile number.
Definitely, and all the best for your future endeavors, and also for the IAP elections. Thank you so much.
Yes.
Thank you, and bye.
Thank you so much.
Bye,
thank you.
Dr.
Thank you.
Yes, bye. Thank you
Mrunmayee
so very
Thank you,
Agnihotri.
everyone.